Hello, everyone. My name is Alyssa Simon, and this is my presentation on ethical dilemma of counselor self disclosure. And in this presentation, I will be applying the ethical decision making model, describing the practitioner's guide for ethical decision making to analyze counseling. To analyze a specific counseling scenario involving whether a counselor should disclose personal experiences related to addiction or to build rapport with that specific client. And throughout this presentation, I will examine the dilemma by applying professional ethical standards, relevant counseling laws, and also scholarly research. In particular, I will reference the ethical standards provided in the American Counseling Association 2014 or the ACA Code of Ethics 2014, as well as, my specific state counseling regulation and federal confidentiality laws. And the goal of this presentation is to determine the most ethical and professionally responsible course of action while prioritizing the client's well-being and also maintaining the appropriate boundaries as well. So, step one would be identifying the problem. So, the ethical dilemma in this scenario involves a client who is seeking counseling for substance use concerns, specifically drug and alcohol addiction. So, during the counseling session, the client expresses that they often struggle to connect with different counselors and things of that nature, specifically because they don't believe that the counselors really have any experience when it comes to addiction or have personally experienced that, and they may not experience or really know what they're really going through. And as a counselor in this situation, I've never had personally any experiences with addiction myself. However, I have had, close family members who, excuse me, who have struggled with substance use issues, and because of this, I began to consider whether sharing this information with the client might help normalize their feelings and strengthen the therapeutic relationship. But at the same time, when it comes to counselor self disclosure, it can create different challenges. And while it may help build rapport and demonstrate empathy, it can also shift the focus away from the client and blur different professional boundaries. Therefore, the main question will be whether disclosing information would truly benefit the client in the best way and continue to build that therapeutic relationship. Okay, so now I'll be talking about ethical, professional, and legal issues. So there are several professional, ethical, and legal issues that must be considered in this situation. So first and foremost, counselors are responsible for maintaining professional boundaries while fostering a supportive and effective therapeutic relationship with the clients. Self disclosure, when used appropriately, again, can strengthen rapport and help clients feel understood. But when self disclosure is improperly used, it may shift the focus away from the client's needs toward their personal experience, and towards the counselor's personal experiences. And that's something that we do not want. And in addition to ethical concerns, counselors must also follow professional regulation and laws. Ethical practice in counseling is guided by the standards in the American Counseling Association Code of Ethics, and these standards provide guidelines on maintaining professional boundaries, promoting client welfare, and also avoiding actions that could harm the client as well. Counselors must also follow state regulations, and in my state is the North Carolina Board of Licensed Clinical Mental Health Counselors, which requires counselors to act in the client's best interest and also maintain appropriate and professional conduct. Additionally, federal laws such as the Health Insurance Portability and Accountability Act protect client confidentiality and ensure that sensitive health information remains private. And the thing about it is, when it comes to that act, it is very important that confidentiality is a good thing, and then making sure that, again, everything remains private, because there are a lot of things that the client might be sharing. And when it comes to disclosure and things of that nature, the client might disclose some things that might be a little concerning because you, as the counselor, disclose certain things. So that's why you have to be careful with what you disclose. And now step 2 would be apply the ACA Code of Ethics. So there are several standards of the ACA Code of Ethics that are particularly relevant to this particular scenario. And first and foremost, the A4A, which is avoiding harm, and counselors must prioritize the well-being of their clients is very important, and this is something that will always be talked about, because we have to make sure that we are promoting their well-being and making sure that they feel heard and seen, and trying to keep them away from any hurt, harm, or danger. And then next would be A5 and A6, which is managing boundaries. And this is where self disclosure should only occur when it serves a clear therapeutic purpose. So that's why it is so important to make sure that we are talking about things that are, you know, important to that client, but also allowing them to, really realize if they want to talk about it, or ask if they want us to disclose certain things. And then the C2A, boundaries of competence. Counselors must practice their areas of competence. Because again, if we only are able to practice what we know, and all this comes from the American Counseling Association 2014, and these standards emphasize professional boundaries and client centered care as well. Step 3 would be to determine the nature of the dilemma. So there are several moral principles within counseling that help guide decision making, and the first principle would be beneficence, which is promoting the client's well-being. The second one would be maleficence, which is avoiding harm towards the client. The third one would be fidelity, which is maintaining trust in the therapeutic relationship. Autonomy, which is a very, very, very big one, is respecting the choice of the client, because again, the client is able to talk about anything that they would like to freely, and we also have to respect their boundaries, and also have to respect the things that they do want to talk about and don't want to talk about, and they are able to pick what they are wanting to talk about. And their veracity is being very truthful, and avoiding harm is the most important thing in this instance and in this scenario as well. Okay, so the next thing I'll be talking about is research and consultation. So, in addition to the different ethical standards, it is important to make sure we review scholarly research when evaluating ethical dilemmas. So, research on therapist self disclosure provides helpful insight into when disclosure may or not be appropriate. So, in different articles that I read about. The first one was Robinson et al., which was in 2025, and it talked about the effective disclosures are brief and very client centered, which is very important because we want to really hone in on client centered therapy, and disclosure can strengthen the therapeutic alliance, which is Carter and Moore in 2025. And then the next one is strong therapeutic alliance improves treatment outcomes, which is Lindquist et al. 2023. And then client perception impacts the therapeutic effectiveness, which is Gonzalez et al. 2023. So step 4 would be to generate the potential course of action, because there are several courses of action that can take place in this specific dilemma. So the first option would be to not disclose any personal information. The second option would be provide limited or extensive disclosure about family experiences within addiction. The third option would be to focus on empathy and therapeutic techniques instead of disclosure. And then the fourth option would be to discuss the client's preferences regarding therapy disclosure. And then generating multiple ethical responses is a key step in ethical decision making. Forrester Miller and Davis 2016. So step 5, the potential consequences of each option. So when it comes to the first option, no disclosure, the pros would be that it maintains professional boundaries, but the cons would be that the client might continue to feel misunderstood because you're not opening up and things of that nature. Option 2 would be limited disclosure, or even excessive disclosure. So the pros may be an increase of rapport and trust, and the cons might be risk of shifting focus away from the client, which is something that we do not want to do. And option 3 would be to focus on empathy, and the pros would be it maintains professionalism and encourages client-centered therapy, and the cons would be that the client may still question the counselor's understanding of everything that they are going through. And then option 4 would be ask client about their different disclosure preferences. And the pros would be that it promotes client autonomy and builds a collaborative therapeutic relationship. And the cons would be that the client's expectations may create and cause more pressure on the counselor. So when it comes to eliminating options, the options that I would eliminate would be options 1 and 2, which would be no disclosure at all, and then excessive or limited disclosure. And I would use a combination of options 3 and 4, which is focusing on empathy and therapeutic relationships and discussing the client's preferences regarding therapy disclosure. And the reasons for this is because it maintains professional boundaries, encourages the client's collaboration, and aligns with non-maleficients and beneficients. And research shows that therapeutic alliance plays a very big factor of treatment success, which again is Lindquist et al. 2023. So, and for the chosen course of action, again, the ones that were eliminated were options 1 and 2, and the remaining options again are options 3 and 4, which it is so important to prioritize ethical practices and the client well-being. American Counseling 2014. American Counseling Association 2014. And now, when it comes to evaluating the decision, the chosen action again options 3 and 4, and which are focusing on empathy and discussing the client's preferences and ethical dilemmas resolved. And there's no remaining ethical dilemma, which is great, and something that I could really think about doing and implementing is the justice test, the publicity test, and the universality test. And with the justice test, it asks, would other counselors view this decision as fair? And yes, because it follows professional ethical guidelines, Forrester, Miller, and Davis 2016. The publicity test is asking, would I feel comfortable in this decision if this decision were publicly known and made publicly known? And yes, I would, because ethical conducts and things of that nature, and rapport and just everything overall is being prioritized. And then the universality test would be, would it be appropriate if all counselors acted this way? And yes, because it aligns with the professional counseling ethics. And number 7 would be implementing the plan. So I'll name some of the implementation steps. For example, continuing to build trust and rapport with the client, making sure I'm using active listening and empathy, discussing different concerns that the clients may have, and monitoring client response and adjusting different interventions. And also, something that is really important is seeking supervision or consultation if there are any concerns that might arise during this time. In conclusion, counselor self-disclosure is such a complex ethical issue that requires careful evaluations. And by applying the steps that are in my plan and things that I would take action in when it comes to the ethical decision model, it would just prioritize the well-being of the client. And in the scenario, the most ethical approach would be to continue to focus on empathy and collaboration and evidence-based strategies while maintaining appropriate professional boundaries. And this approach really protects the client's well-being and strengthens the therapeutic relationship, and just aligns with the ethical standards within the counseling profession. And here are my references. And yes, thank you so much for listening.